laying off the manicures, calming your fears of a black toe, and a deeper meaning behind chewing your nails. It turns out that you can learn a lot from your fingers and toes. Here are the health secrets your nails are trying to tell you. It can be frustrating to have weak nails that keep breaking off, whether they are soft and bendy or dry and brittle. The nails usually feel a bit weaker when you remove faux nails. Your nails might get weak after you've used some nail polishes, nail polish removers, or nail treatments because they contain harsh chemicals. Some everyday products contain harsh chemicals, which could weaken your nails if they're unprotected, including dishwashing soaps, detergents, and cleaning fluids. Your nails might also get weak and soft because you repeatedly get them wet. Healthline adds that weak nails could be caused by not moisturizing your nails after wetting them and leaving them to dry out, especially in cold or dry weather.
For moisturize, moisturize, moisturize. You want to use something that's thick and occlusive. I like ones that contain shea butter, coconut oil.
Weak nails can also be a sign of a health condition, especially if you notice that your toenails and fingernails are not strong. Healthline states that these conditions include hypothyroidism, which is often accompanied by hair loss, weight gain, depression, and constipation. It could also be caused by Raynaud syndrome, which is caused by problems with blood circulation. Missing certain nutrients in your diet can also weaken your nails, such as B vitamins, calcium, omega-3 fatty acids, biotin, and iron. The nail fold, or the skin that borders your nails, swells up when it gets inflamed, and this is known as paronychia. Nail inflammation is usually the result of a bacterial infection. Bacteria can get into the nail fold through hangnails, injured or irritated skin, ingrown nails, or nail trauma from biting and other accidents. Whatever the cause, an inflamed nail fold doesn't only swell, it's red-hot painful, and could contain pus that accumulates to form an abscess. It can also cause major damage to the nail, make it separate from the bed and fall off, or make new nails grow out deformed, discolored, or flaky. According to the Cleveland Clinic, this damage remains even after the inflammation has healed. People with chronic paronychia experience this several times, for long periods of more than 6 weeks, and sometimes in more than one nail. While the cause is not completely understood, it's most commonly seen in individuals whose hands frequently get cold and wet or who have had hand dermatitis. According to DermNet, these could be bartenders, fishermen, dairy farmers, cleaners, or people with poor circulation. Occasional nail biting or picking is not usually a cause for concern. These habits are common among children and teens who eventually outgrow them. However, Healthline notes that there might be a problem if your nail biting or picking brings shame or is so consistent and uncontrollable that you can't stop even when you injure yourself. In this case, nail biting or picking is seen as a body-focused, repetitive behavior or uncontrollable acts that damage the body. Other examples of these behaviors include compulsive teeth grinding, cheek biting, hair pulling, or skin picking. Healthline says that nail biting or picking could be because of an anxiety disorder. This is usually accompanied by other signs like phobias, sleep problems, muscle tension, irritability, trouble concentrating, or always feeling tired. These bad nail habits and other body-focused, repetitive behaviors could also be signs of obsessive-compulsive disorder, ADHD, oppositional defiant disorder, separation anxiety, or Tourette syndrome. The toenails, as well as the fingernails to some extent, normally thicken as a person gets older. But according to Medical News Today, if you notice an unusually thick toenail, it could be a sign of a fungal infection. Thick toenails could also develop as a result of repeated trauma to the nails. They could also be a sign of conditions like psoriasis, yellow nail syndrome, or chronic paronychia. Whatever the cause, you need to get thick toenails checked and treated, especially if it's from a fungal infection. Leaving the infection untreated can thicken the nails even further. Healthline notes that this might make wearing covered shoes or simply walking uncomfortable. You may notice other symptoms from a nail fungus, like a collection of dirt under the nails, discoloration, a bad smell, nail breakage, nail separation, and the affected nails may look dry and whitish. It can be frustrating when your nails just won't grow. Maybe you're recovering from a nail disorder or nail damage and can't wait for the bad nail to grow out, or perhaps you simply want to grow them just a bit longer. The nails actually grow slowly. Healthline notes that the fingernails only grow about 3.47 millimeters in a month, while the toenails grow about 1.67 millimeters in a month. It would take up to half a year for the fingernails to be completely replaced and a year and a half for the toenails. This growth rate slows down as you get older. There are some things you might be doing or neglecting that could slow down your nail growth. According to Fustany, this could be biting your nails, doing dishes without gloves, eating an unbalanced diet, not moisturizing your cuticles, filing your nails, or getting them done too often. Certain nail products like nail polish removers containing acetone or poor quality nail polishes could also be responsible for slow nail growth. Healthline adds that you can encourage growth by clipping and cleaning your nails, taking a biotin supplement, or using a nail hardener. You might not really think of the white, half-moon-shaped area at the base of your nails, also called the lunula, but it has lots to say about your health. It's actually a part of your nail matrix that your skin doesn't cover, so many people can see it through their nails. However, some people might not see their lunula or only see the one on their thumb. Not seeing the lunula could simply be because of factors like skin color or the cuticle covering it. However, an absent lunula could also be one of the signs of malnutrition, anemia, or depression. Some people may have an overly large lunula. While it's not clear why this happens, Healthline says that it might be due to low blood pressure or other heart problems. Certain health conditions could change the color of the lunula. These include heart failure, which turns the lunula red, or chronic kidney failure, which gives it a brown color. Uncontrolled diabetes could give the lunula a pale blue color, and Wilson's disease could turn the lunula blue. Excess amounts of certain chemicals in the body can also change the color of the lunula. A blue-gray color can indicate silver poisoning, a brown or black color could mean excessive fluoride ingestion, and taking tetracycline medications for a long time can turn the lunula yellow. It's a common myth that you should remove nail polish periodically to let your nails breathe. Not only do nails not breathe, the Wexner Medical Center reports that they acquire the oxygen and nutrients they need through the bloodstream. This means they don't actually require a physical break between manicures to maintain their health and strength. However, it isn't a bad idea to leave your nails bare on occasion, especially if you like to partake in regular gel or acrylic manicures.
When you do apply that fake plate on top of your nail, they usually have to really weaken the underlying nail. They have to rough it up so that the plate will adhere.
Common signs of nail damage as the result of wearing nail polish are peeling, thinning or bendable nails, brittleness, and breakage. Keratin granulation, or white stains on the nails, is caused by prolonged wear drying out the nail beds. This usually requires a break from polish to see the nails return to their normal color. The abrasive removal of gel and acrylics via picking or an impatient manicurist can also lead to significant nail damage over time. If you notice your frequently painted nails aren't looking their best, work on implementing a proper nail care routine. Applying a moisturizing cuticle oil rich in vitamin E, antioxidants, or jojoba oil to the nails between manicures can help transform the condition of your nails. Taking a biotin supplement may also help strengthen brittle nails. If you've ever trimmed your toenails and felt a sore, sensitive, and inflamed toe a few days later, you have likely experienced an ingrown toenail. According to Informed Health Online, ingrown toenails are a common problem, affecting teenagers and adults over 50, and resulting in 20% of all reported foot issues. Improperly cut nails and poorly fitting shoes are the most common culprits for this painful nail growth, which occurs when the nail's edge begins to curl and embed into the flesh of the toe. Depending on how quickly you notice an ingrown toenail developing, you may be able to treat it at home. Epsom salt soaks target inflammation and are ideal for easing the pain of an ingrown toenail. Additionally, applying an over-the-counter antibiotic ointment to the affected area can take care of a developing infection. Unfortunately, ingrown toenails can turn ugly fast and require the attention of a medical professional who may prescribe antibiotics or apply a splint to help correct the toenail's growth. Depending on the severity of the injury, a doctor may need to perform surgery to remove all or part of the toenail. A surprise purple-black spot under your toenail may feel like cause for alarm, but according to Stat Pearls, it is often diagnosed by a doctor as a subungual hematoma. Although this diagnosis might sound intimidating, it is simply the result of bleeding under the nail bed, caused by the toenail getting crushed or slammed. Black toenails can occur from poorly fitted shoes, one-time injuries like stubbing your toe, or dropping a heavy object on it. They are often accompanied by a painful throbbing due to breaking the blood vessels, and the black color is the result of blood pooling beneath the skin.
Didn't you feel any pain?
Yeah, it really hurt.
That toe is almost dead. I think I gotta take you to a doctor.
To treat a painful black toenail, you must visit your doctor to have it diagnosed and drained with a simple pinprick. During this visit, they'll also be able to determine if any bones were broken. Most dark patches resulting from trauma will heal on their own, and the discoloration will grow out. However, any changes in look or feel should always be examined by a doctor.